Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about something that should not be a shocker for you, but maybe just a reminder that the choices we make have a huge impact on both our risk of developing cancer and your likelihood of surviving it. The problem I see is that mainstream oncology generally just cares about what they're doing at the moment. So chemotherapy, radiation, surgery, those are the strong tools in helping somebody overcome and get 5-year survival rates. However, the data is very solid, very clear that the choices we make, dietary, exercise, stress management, all of those have a huge role in outcomes, which is no different than this particular study that looked at women who had had invasive breast cancer. So like the really bad type of breast cancer that's metastasized. Keep in mind that breast cancer, like we've got 3.5 million breast cancer survivors in the US. So when we look at this data, the amount of deaths from breast cancer that could be prevented is significant. It's huge just from making one simple change. This particular study looked at 927 women. At the time of diagnosis, they were between 35 and 79 years of age. They followed them for 19 years, so it was a pretty long study to look at whether people died of breast cancer or from what's called all-cause mortality, their likelihood of dying from anything. And once you've gone through chemo and radiation, like if you don't make the right choices, you're more likely to die from different things because those treatments can be so rough and so hard on the body. Of that study, 41% of the people died by the end of the study. So that's a pretty big chunk. Now granted, the 79-year-olds, you add 19 years, like there's some degree of that. But one of the things they found was that people who had soda 5 or more times per week, so this is not even daily drinking of soda, and gosh forbid if you're having 2 or 3 or 4 of them a day, they had an 85% risk of dying from breast cancer in this group, and a 61% in dying from anything else, all-cause mortality. Like 85% increased risk from just having a soda 5 a week, not even 1 a day. So clearly soda needs to be off the list, but again, this shouldn't come as a big surprise. 2 things we know. First of all, the high fructose corn syrup, sugar feeds cancer. Like that's really pretty clear. The sugar, cancer cells as they're growing require a tremendous amount of energy, and they are just sugar hoarders. So the more sugar they have, the more they can support their growth and survive and thrive. But also, we know that high fructose corn syrup actually contains a pretty decent amount of mercury in it from an alkali process that they use to stabilize high fructose corn syrup. Most people aren't aware of that, and the cans are usually loaded with BPA, which will then increase the risk of breast cancer problems. So not a terribly big surprise, but just a reminder that if you'd like to avoid breast cancer, or you've had breast cancer and you'd like to not die from breast cancer, then the choices that you make have a huge impact in your end outcomes. As always, I will post a link to this particular study in the description. Make sure you share this video with somebody who you think needs the information and subscribe to the channel.